about a year ago, we started noticing that she started throwing up. So here she is, this happy-go-lucky girl, and all of a sudden she starts throwing up. And then after she throws up, she talks about how her head hurts. She was very backed up. I mean, the x-ray showed a lot of waste there. So he's like, well, what you need to do is put her on a better diet. Get some laxatives, et cetera, et cetera. That's how we kind of handled it for about 6 months. And then all of a sudden, the left eye just started to stray off. So we booked an ophthalmologist appointment. So the ophthalmologist took a picture of her eyes, and that's when he noticed inflammation.
When we get concerned is when there are headaches that are worsening, that are waking up at night. The other thing is unexplained nausea and vomiting. We can't find a cause of why they're having all this nausea, vomiting, and headache and other symptoms. Then it's time to get a scan.
He just said, that we found, a mass in the back of her head, and it's pressing against the back of her brain and causing a lot of inflammation, I guess, in her head.
She had a very large, about 7-centimeter tumor within a space that's only about 12 to 15 centimeters across. So it took up more than half the volume of her cerebellum. And looked like it was invading into her brainstem. That's something that we had to take out, or this would kill her in a relatively short amount of time. So our first step was to treat her hydrocephalus, because that was the first pressing problem, causing the pressure, the fluid building up, causing problems with her brain function. It could cause compression of the brain. So we put in a drain into the ventricles, the fluid spaces in the middle, to take that pressure off. And then we're able to go in from the back with an incision, sort of on the back of her neck and back of her head. Go in, take the bone off, and then get access to the lower part of the brain, the cerebellum. And then brought in the operating room microscope and begin to carefully dissect it free.
He got 98% of the tumors out, but it was too risky to get the other 2. This particular part of the brain deals with mobility, and with mobility comes balance.
And having a physical therapist, occupational therapist, and speech therapist that can work with the patients every day, I worked with Gracie every day to help bring her speech back, to help get her balance back, to help her learn to swallow appropriately. These are very essential for the recovery, even after the tumor's out.
I was blown away at the evaluation because she was able to do so much of what they said. I was there to see, she couldn't even sit up. So every moment is a new success.
I think Joe DiMaggio, with this model of family-centered, patient-centered care, does a great job of including the family in every step of it. And then having all those people come together and give excellent care enables the children and the family who suffer through this as well to sort of recover as a family through the entire process.